Well, as if we don't already have our hands full with COVID, Delta, Omicron, there's a new condition that has entered the mix.
It is called flurona. It's when someone gets COVID and the flu. I can't deal with this. Ed Lascos live for us tonight in West LA. Ed, say it ain't so.
I wish I could, but it is so, unfortunately, and doctors are concerned about it. So talk about pandemic burnout, huh? A new health threat now that we have to worry about. So think about it. If you catch COVID-19, unfortunately, your immune system's in a weakened state, so you are then a prime target, high risk to catch another infection, the flu, all at the very same time. And add to that all as we're right in the middle of this latest surge. Check this out. 911 calls already surging as the Omicron variant explodes through the Southland. The surge striking at the worst possible time, winter, and the start of our flu season, bringing a new health threat called flurona, being infected with COVID-19 and the flu all at the very same time, with the very same symptoms, all attacking your respiratory system.
Oh, it's absolutely scary. It's terrifying. COVID, especially in an unvaccinated person, can feel absolutely terrible. And if you remember, influenza doesn't feel so good either.
The first confirmed case of flurona now detected in Israel, a woman in her 30s, suffering the same symptoms from two separate infections, raising concerns here a twin epidemic could be on the way.
It is absolutely a possibility. Right now in Southern California, or in California as a whole, we have relatively low rates of influenza. Typically, flu doesn't begin in Southern California until around mid-January, so we're coming up on it really soon.
That as the explosive COVID surge has testing sites busy already, most with lines and wait times, a skyrocketing demand for testing that's even overwhelming ERs and urgent care centers, even before we're hit with a possible flu surge.
Already at Santa Monica Urgent Care, we're seeing 3-hour waits today. It's rough out there.
The LA City Fire Department facing a big increase in its 911 calls, now implementing its ambulance surge plan as LAFD tries to free up more ambulances as wait times are growing longer for patients who need available beds.
We'll send an emergency medical supervisor to that hospital. They work with the hospital staff. They really determine what the underlying issue is, and then that way they're able to expedite the release of ambulances.
Doctors still insist COVID and flu vaccines, both of them, are the best protection now from flurona and a possible twindemic that could hit this winter.
It's hard to predict what's going to happen. Look, we can't predict anything that happens with the coronavirus pandemic. What makes you think we can predict what's going to happen with the flu right now? We're living in crazy times.
Crazy times, the doctor says now live. How crazy? Well, listen to this. Last year, remember, not much of a flu problem or outbreak around because of all the safety measures we were taking, so you would think that would be good, right? Not really. It turns out we might be more susceptible to catching the flu this year because our bodies did not have a chance to build up the immunity against the flu last year because it simply wasn't around with all the infections. The good doctor says middle of the month to the end of this month is when flu season really kicks into high gear here. We'll see what happens. Keep our fingers crossed. Hold your breath. For now, we're live here, West LA. Back to both of you.